Good afternoon.
Welcome, Doc. How are you?
I'm good. I'm
Great
good.
to see you. How's Houston?
It's getting
It's
hot
Houston?
already.
Yeah.
So for the record, my name is Giuseppe Colasurdo, President UT Health. Slightly different accent here from our good friend at UTMB. And this is also my 8th legislative session, just like Dr. Klotman. I believe he asked for a medal. I would pass on the medal, and I would like full funding for our School for Behavioral Health Science. You have a slide deck that Scott Forbes, Kara Crawford, Jennifer Deegan have provided. Obviously, I will not pass on describing where UT Health is today. As you know, UT Health Houston, or the UT Health Science Center in Houston, was established in 1972 by the UT System Bordeaux region, the Texas legislator, so relatively young. By Italian standard, University of Bologna was founded in 1088, just to give an idea, on the age of universities here. But again, very young, and now it is just a total powerhouse with the 7 schools that we have. One of the most comprehensive academic health science center in the nation. We have over 55,000 alumni and graduate from UT Health Houston. Again, very, very large number addressing the workforce needs of the state of Texas. We see over 2.5 million clinic encounters per year. And thanks to the Texas legislature, we have now the largest academic behavioral science center in the country with HCPC and the Dunn Center with 540 inpatient beds. So really, truly a remarkable university becoming very essential for many communities around Houston, around the state, and around the country. So just to summarize in bullets this partnership between UT Health and the Texas legislature, again, only about 50-year-old. We have the #1 ranked school in Texas for nursing. CISIC is ranked #1 in Texas and one of the highest ranked in the country for BSN, with our wonderful Dean Santa Maria. We have the #1 ranked School of Public Health in Texas and one of the highest ranked in the country, 4th largest in the United States. And as we talked about the COVID lessons, one of the main lessons we had was the gap in public health knowledge, in public health education. We had a lot of ventilators, ICU ready for our patient, but we did not have the infrastructure with knowledge and public health education that we needed. We have the only school in the nation for biomedical informatics, ranked #2 in the world. And this is a school that has been at UT Health for 25 years. This is the bioinformatics, this is data sciences, artificial intelligence. We have the world expert in these areas at UT Health Houston. So we encourage the legislator to reach out to these amazing individuals we have. We call them the scary bright kids. And they are basically essentially recruited even when they enroll from Amazon, Google immediately. And again, this is a tremendous asset for all of us here in the country of Texas. We have a school of dentistry that is very old by American standard, 120-year-old, and that's ranked in the top 10 for NIH funding in the Blue Ridge ranking. We have a world-class graduate school for biomedical sciences jointly with MD Anderson. Imagine what can you be or do if you are a student in the GSBS in terms of cancer biology, neurosciences, medical physics, genetic counseling, truly world-class education. Our School of Medicine, of course, I'm biased, one of the best in the world, the McGovern School of Medicine. And tuition is $24,000, $25,000 per year. You already heard from Dr. Klotman what the tuition is, $70,000 to $80,000, lowest student debt that you can think of, and consistently ranked by Vizient in the top 10 teaching hospital in the United States, Memorial Hermann TMC, with the Mayo, with the Emory, with the NYU, with the Hopkins. And this is where we want our trainees to practice, in the top teaching hospital where we have no serious safety event. We have 0 deaths in some areas. And as I hear about the GME discussion, so this past year we had over 20,000 applicants for about 200 positions. 20,000 applicants for 200 positions. Imagine how difficult that is. And the main problem is related to, once again, a GME funding. We have barely a 1-to-1, 1 to 1.1 ratio in terms of graduating student to GME. These are all the Medicare spots that they were assigned. Everyone is at the cap. So the stipend is really a barrier for that. If you go to New York, it's almost 1 to 3, 1 to 4. But imagine how many students we could pick up, and we fill 100% of them, okay, with 20,000 applicants. And the 7th school, I would like to spend just 30 seconds on that on the next slide, on your slide number 4, where we have our legislative priorities. So very quickly, formula funding, you already know how essential that is. We have funding for the all-payer claim database. We have TEFI. I was very happy to hear from Dr. Klotman as well, how powerful this infrastructure is right now. This is just probably one of the most sophisticated educational and research platform available in the world. We have people calling from all over the world to reproduce what they do. They're able to screen, as you can see in your slide deck, over 3,000 viruses, over 15,000 variants, and nobody has that. And we will never be able to access this information from the federal government. The Children Learning Institute funding, very grateful for the dental clinical education formulas. I think we have been trying for that for 15 years, as long as I remember, so we're very grateful for that. We are very grateful for the mission-specific formula. And if you look on slide number 4, there is a young kid in there, Dr. On the bottom. That's the third at the bottom. So this guy, we hired him 15 years ago from Merck. And this is a gentleman who today has 19 molecules, antibodies, of which 11 are already in phase 1 and phase 2 trial, talking of commercialization. And that's against cancer, spinal cord injury, stroke, really a large variety of illnesses where he's going directly after cures. What we do, and we will not be able to do this without the mission-specific formula. Every year, every month, we box him out, we take him out, right? Because everybody wants him. Stanford wants him, Northeast wants him. So this is a UT asset thanks to you, and we are very grateful to have, again, this is a single PI having 19 targets, of which 11 are already in clinical trial. There are laboratory and multiple PIs that in their entire career have 0. My last comments are related to the School for Behavioral Health Sciences. Please, no medal for me, but we really would like to have your attention to a school that will change, just like public health has changed our knowledge over the last 50 years, and the School of Biomedical Informatics has changed our knowledge on data, analytics, and AI, and that's a School for Behavioral Health Sciences. It's going to be very efficient, and the reason is we are able to tap into faculty from the other 6 schools, and I honestly don't have to give a lecture on the massive challenges that we have in public health. The number 2 cause of death in people less than 14 years of age is suicide, 0 to 14 suicide. And the number 3 cause of death from people between 15 and 25 is suicide. So everything happens very early on. We have over 90% of the counties in Texas without a single child and adolescent psychiatrist. This school will address the major gap that we have in workforce. And you have the detailed presentation on the numbers, how we will do it. We tried during the last session. We did not have much luck. But I really hope that you seriously consider a school that will change the way we treat these poor patients. And the reason why nobody wants those patients, because they don't make any money. They don't generate any margins. These people need access to providers. We do not have providers. We have hospitals closed today. We cannot operate them because of lack of providers. And this will be the pipeline for not just Houston, for the state. And I think you heard already, to be able to have high quality education, you need patients. And we have so many patients in behavioral sciences. You need infrastructures. Thanks to you, we have a 540 bed. We have 35 community clinics, and we have telemedicine across the entire state of Texas. And you need dedicated faculty. That's a key element. If you do not have dedicated faculty, teachers who want to train the very best, you can have as many patients as you want. It will not work. So this special item request we have is just for that, is to be able to have the grown-ups, the teachers, the master clinicians, to be able to address this massive crisis we have in workforce. And I'll stop here, and I'm happy to answer any questions.
Okay. I don't see, Senator Hinojosa.
Just one quick comment, Madam
Yes, of
Chair. and
course.
that is, I had the pleasure of meeting your staff at the event you held here in Austin. Very impressive. I think I also met Dr. Han during that reception. So thank you for making time to come and visit us here in Austin. Thank you, sir.
Thank you.
Sure.
Senator Kolkhorst.
Thank you. Good to see you again.
Good to see you, Senator.
You have been here forever, right?
Forever. Medicare card right here.
Yeah, that's right. Good to have stolen you from Italy. You made a statement I'm not sure I understood. You said when the patient, and that you were talking about behavioral health, doesn't produce any income. What can you tell me what you said there? I might have
Sure.
misheard that.
Sure. Well, if you look at the strategic growth of health system, basically follows the diseases, human diseases, where there are margins. Okay? So you see explosion of surgery centers, right? Interventional catheterization lab, right? So this is where the margin is. Cancer care today is actually generating very significant margins. When you go to behavioral health, it's very difficult to generate any margin or pay because there are no imaging, there are no procedure. It's all again, revenue generated by a physician. And as you know, we only make $100 where we document like a level 5 encounters in clinics. So if you try to go to a private center, you have to scan a credit card for $50,000 a month if you want to have access to care. And of course, we have this 540 bed where there is a wait list. Thanks to you, we have been able to cut that down, right? But there is not much interest in clinical services, way overdue, right? And that is our responsibility because health systems will not do it. If the Texas legislature does not allow academic center, where actually the good guys want to care for those patients, right? Nobody will do it. We will see this number on suicide, right? Going to level we have never seen before because we just don't have provider where these kids can go so we can get the targets and cure them.
Okay, if anybody's watching out there and you want to take a clip of healthcare today, just take that clip, his answer. And I think it's really important what you said. And so when I'm talking about changing the way we do healthcare, obviously we would love to stamp out cancer, but as you say, it's a huge profit center. There are a lot of. I laughingly saw the face of a lobbyist who lobbies for a cancer group when I was talking about making America healthy again, and we could get rid of some of these chronic diseases. And I saw that person's face kind of fall, like, "Oh, hold on, here we want those patients." I'm not saying that person meant it in a bad way or a nefarious way. But you're right about how our system incentivizes how we pay and where the profit margins are. And so I look forward to working with you. You've always been very thoughtful, even when we don't agree. But I want to really I want to really challenge us. In this notebook today, Madam Chair, are billions of dollars when we're talking about higher education. And really, the billions really gets really large when we're talking about the HRIs. And we make, Senator Nichols and I are talking about our Doge project up here. This is our Elon Musk of the Texas Senate, okay? And he is talking a lot about patents and why we don't cut a good deal from the government side and what is the return on investment. And actually, if we did a better job with some of that, we shared some of the profits, you come to me about some behavioral health thing and we've got this whole evergreen pot because it's coming back to us and we're able to use it again and the taxpayers are not having to give what I would call almost de novo new dollars in this. So I look forward to working with you. I'd invite you to our office. Let's sit down and I'm famous for my whiteboards with my staff. But let's really talk about this because there is a new day in medicine coming. If you look at the Trump administration and the different people that are being confirmed as we speak, and everybody take a deep breath, it's going to be okay. Because again, we spend more than any other nation in the world and we rank really very low. So I look forward to working with you.
Thank you.
Thank you. I think that's all the questions we have for you. Again, thank you for all you do.
Madam Chair.
Here. Senator Creighton, you are recognized, sir.
I was running behind on that. Sorry.
Well, that's okay. I did, yeah. That's fine.
I just wanted to say thank you for your testimony and for being here, for your excellent presentation, always working with your outstanding team, and for your many 30 years of just distinguished service and all that you've done for Texas. You're certainly a treasure. We appreciate you very much.
Thank you, Senator. Thank you so much.
Definitely. Thank you. Thank you very much for being here, sir. Okay, we will move on to the University of Texas MD Cancer Center. Dr.